It's an innovative and interactive approach to healthcare, group medical visits. Led by a physician, group medical visits bring together patients with common needs. At UW Health at the American Center, cardiac patients are cooking together and learning the benefits of the Mediterranean diet. The group meets once a week for 6 weeks at the Learning Kitchen.
Patients get a checkup, as you just saw there, and then they have a chance to share common experiences and stories with each other, and that leads to building real friendships. Dr. Tom Walhaus from Unity Point Health Meritor, he's a cardiologist there. He's one of the physicians who brought this concept to Madison. Tom, good to see you.
Interesting concept.
Thank you for being here. It is a really interesting concept. It was fun to be there and see how all of the patients interact together. Who are the people who come to this class?
So it's a variety of people. You have to have a diagnosis of some common problems that are heart-related: high blood pressure, diabetes, high cholesterol, or a history of vascular disease, atrial fibrillation. Any one of those things that you can come to this class.
But
it's not a class, it's a medical visit.
You don't need a doctor's referral to go.
You don't need a doctor's referral to come to this. So a lot of patients come through other providers. Some of them are my patients, some of them are some of my partners' patients, some of them are come from the community.
So this gets billed through insurance?
It does.
It's a medical...
It's a medical visit. So people come, they get... I examine them. It's a brief examination, but it's shared with other patients. It's confidential, but it's a medical visit, and we get the opportunity to teach in addition to providing some medical care.
Some camaraderie and cooking.
Right. So cooking is the other neat feature. We have a state-of-the-art studio. We've got a professional chef. I'm not a good cook. I learned just as much. We learn to use things in the kitchen, how to use a knife properly, how to cook things. The idea is healthy meals. The idea is to cook things that are simple, that are healthy for your heart. And there's a life coach there, so there's a component of this that has to do with wellness and how to live a healthy life. So we start with a meditation. We do a little teaching. We have an open session for people to talk to us about what their experiences are and shared experiences. And then we cook a meal together, and while we're eating it together, I usually pick a topic that has to do with something to do with the heart or healthy life. Last night we talked about exercise, for example. We don't always talk about food.
What a great idea.
It's such a great idea. I think you could do this for any specialty, but especially for heart patients. Aren't cardiac patients at a higher risk of depression and things like that?
Yeah, so there's... The amazing thing is that there's a common ground here. There's a lot of common illnesses. It's vascular disease, it's dementia, brain disease, it's cancer. They all seem to be responsive to healthy eating, healthy cooking, healthy lifestyle. So there's a common ground here. So I think you could expand it to cancer patients. You could expand it to patients who are at risk for Alzheimer's. I just happen to be a cardiologist, so we focus on cardiology.
And I understand people hang around afterwards, you just talk and chat and build friendships?
My wife's birthday was yesterday, and I had to get out of there early, but a lot of times I have to stay, or I love to stay. You make friends. Everybody, you saw.
Yeah.
People, we've got a fantastic group right now, really just a neat group of people, and they hang around and they talk to us and they ask questions, and we talk about coconut oil, and we talk about exercise, and we talk about you name it. You can't imagine what comes up, and we try to do our best to figure out what the right advice is.
But they're all on the same journey, so they all have similar experiences.
Which is neat.
And it's so great to meet other people who are going through the same thing you're going through.
I think you saw that people share their this happened to me, oh, that happened to me as well, and they find that they have some common, shared experience, and they also have some common questions, and it's good for me to be able to sort of spend time on the same topic with a larger group of people.
And they made minestrone last night, and it smelled so good.
It was good. I brought some home.
The cooking for your wife's birthday?
Yeah. That wasn't the only thing I brought.
Thank you, Doctor. The Cooking for Heart Health classes held every Wednesday from 6 to 8 at the Health Center.
The Learning Kitchen at UW Health at the American Center.
Help me out here.
Yeah.
The current session ends May 29th, but to register for future sessions, call 608 888-440-6600 or go to uwhealth.org.
And Dr. Walhaus, when is the next session? Probably later this summer or early
Probably
fall?
later this summer. Yeah,
Okay.
we're going to finish one at the end of May and then probably start June and July.
So just call or get online for more info.
Yes.
Doctor, thanks for being
Keep up
with
the
us.
great
having
work.
me.
What a great
Great to
program.
see you.
Good to see you.
We'll be right back with the